Welcome, everybody. Our apologies for the 8-minute delay. We had quite a few technical difficulties with the webinar this morning, but we are ready to go now. We know that there are our highest ever number of webinar registrants, nearly 200 people registered, and that is a testament to the interest that this topic and these speakers have generated. This is the first in a webinar series that the CPC Learning Network will be co-hosting with the International Institute for Child Rights and Development at Royal Roads University. I am Mark Canavera, the Associate Director of the CPC Learning Network, and we have a very interesting presentation today that launches our webinar series on the way that child protection systems should seek to reach the most vulnerable children. So in the coming 6 months, be on the lookout for more of these. Every 4 to 6 weeks, we'll be tackling topics such as civil registration, transitional justice, and how, as we strengthen child protection systems, we should always be keeping a focus on the most vulnerable children. Our speakers today are presenting their experience working with the NGO World Vision on how precisely programming should, through a systems lens, research the most vulnerable children. The two researchers are Dr. Philip Cook and Dr. Mike Wessels, and I'll give you brief biographies of them. Dr. Philip Cook holds a PhD in cross-cultural psychology from Queen's University and is well known throughout our sector as the founder and the executive director of the International Institute for Child Rights and Development, IICRD. He has overseen that institute since 1994, and it has become a leading institute on children's rights, healthy development, and broader issues of human development and participatory governance. He will be doing the main presentation today for approximately 35 minutes. Then we will have a brief response from his colleague on this project, Dr. Mike Wessels, who is a longtime psychosocial and child protection practitioner and a professor in the Department of Population and Family Health at Columbia University. Finally, we'll have a brief response from Andrew Ware, who's the manager of the Policy and Program Unit at World Vision, World Vision UK, which is the NGO that supported these efforts. I know we've already had a delay, and I want to get straight to the meat of this, so with no further ado, I would just remind all participants that if you have questions for the presenters, you can type them into the chat box. You as attendees will not see the chats as you can on some other webinar platforms, but they will reach us, and we will consolidate and hand them over to the presenters, and they will answer questions towards the end. Thank you very much, and over to you, Philip.
Great, thank you. Thank you, Mark. It's a real pleasure to be here today, and I'd like to also echo Mark's earlier words and say that it's a great pleasure, particularly to be co-hosting this series with the colleagues at Columbia University. And as part of that, it's suiting that perhaps Mike and I lead off with this, because it was also a great pleasure sharing this research with Dr. Mike Wessels. And we're also very appreciative to the support of World Vision and Andrew's presence with us here today in allowing us to engage on this learning journey with World Vision. The series and this presentation today are very much offered in the spirit of research and practice, and looking at the connection in terms of system strengthening for child protection in regards to the role that research can play. And as you can see from the first slide in the presentation today, very much looking at children's own lived experience and the reality of children, the complex reality in the worlds in which they live. And this study was part of a global study in partnership with World Vision and the British government through DFID. And what we'd like to present today are the findings, particularly in the three countries where field research took place, which included Tanzania, Cambodia, and Eastern DRC in conflict-affected communities. As I mentioned, the context for the research was a partnership between World Vision and DFID, particularly the PPA program, the Programming Partnership activities of DFID, and a focus on poverty alleviation within which child protection was included. And particularly in this context, looking at better understanding the lived realities of very vulnerable children, and really trying to grapple with the notion of what do we mean by vulnerability, and how can we create programs in partnership with communities that are better able to include and respond to the needs of those children and their families. So in beginning this journey, we started with World Vision's definition of vulnerable children. And I should say at the outset, and Andy may come back to this, that World Vision has very much taken this notion of reaching out to the most vulnerable children as a core dimension, not only of their child protection programs, but their programs in general. And we were really interested in who are the most vulnerable in the context of 4 factors that World Vision defines. The first is extreme deprivation, so children living in extreme poverty, for example. Children experiencing serious discrimination, so this might include girls or children from ethnic minority populations, or children in the context of conflict who are being targeted by violence. It could also include children experiencing abusive relationships and looking at the influence of violence, exploitation, and abuse on children's lives. And as you see from these 3 factors, and adding the 4th one of catastrophes and disasters, which would have been the context for Eastern DRC, to see how various factors stack up for children in terms of specific risk factors, and how those risk factors need to be understood in relation to protective mechanisms that also exist in children's communities. World Vision defines child protection as a set of coordinated formal and informal elements, and this notion of better understanding how the informal elements of protection, particularly what we call the organic elements that exist in communities, so the role of extended family or peer networks for children, or the role of faith traditions, need to be better coordinated with the formal government systems, which would typically include things like social welfare ministries or the Ministry of Health or Education, was really at the heart in terms of understanding how both those systems can better respond to vulnerability across the lifespan of children. There's an emphasis running through the research that also relates to World Vision's protection systems thinking in terms of well-being. And while we start from a rights-based approach, we were also interested in this broader concept of well-being in terms of how children thrive. And finally, we're looking at this in the broader context of children's lives and a focus on accountability in terms of circle of care for children, and an emphasis on their resilience and the role that life skills play in that process. The overarching research objective for the study, and I should say at this point that there is a report. In fact, there's a short version and a long version that people can read at the end. But in a nutshell, the overarching research objective was to establish the extent to which World Vision's protection programs were including and impacting most vulnerable children. And we were really looking at 3 specific case studies, and then breaking this down into 4 sub-questions for the research. The first was to examine to what extent the PPA child protection program was including the most vulnerable children. So what are issues of inclusion? Secondly, to look at what is the impact of programs on children's lives, and to really look at impact in very specific ways in terms of behavior change, change in attitudes in community, or change in social structures and social norms influencing children, and we'll come back to that later. The secondary research questions, the final 2 research questions, focused on the barriers that prevent most vulnerable children's inclusion in the child protection programs. So in this case, looking at specific barriers that might influence girls, for example, or exclude girls from participating in programs, and also looking at specific barriers across the lifespan. So families that might be vulnerable with small children all the way through to youth who were accessing the job market or might have been involved in conflict-related activities. And the final question of the research, which is a very important one to us, was to really look at this issue of self-protection. So how do children and their carers reduce vulnerability to child protection risks? And what are children doing themselves with their peers? What are they doing with their families? And how can we better understand this aspect of resilience and children's own creativity in navigating risk and building on their own protective mechanisms. And as I said at the beginning, understanding all of this within the context of formal, non-formal system strengthening, which is of great interest not only to World Vision, I think, but to many of the other sectors in child protection. The research lasted approximately 12 months. It started with a literature review, and I should say at this point that Rebecca Nelms, who's unfortunately not with us today, was a key part of this aspect of the research. We also conducted key informant interviews with World Vision staff and other child protection experts. There was a desk review of a number of other countries that were involved in the DFID project, and then Mike and I led the field research in Tanzania, Cambodia, and Eastern DRC. And in each of those countries, we were working in typically two communities, ADPs, Area Development Programs in World Vision terminology, typically trying to contrast urban and rural settings, as well as a conflict community in Eastern DRC, which was Northern Kivu province, the town of Beni. The methods for the research were primarily qualitative. We were asked by World Vision at the outset to particularly include participatory activities with children to understand better their lived realities and to engage children not only in the data collection but in the analysis and the understanding of that data. And some of the tools that we used included relational mapping, so understanding children's patterns of relationships with their peers and key adults in relation to program inclusion, social mapping to spatially understand patterns of risk in communities and how those patterns related to specific groups of children, girls and boys, younger children, older children, girls from ethnic minorities, etc. And to actually have children lead us through their communities using transect walks to better understand those things in the lived context of communities. We also used a most significant change activity called River of Life, where we were specifically looking at the direct impact of programs in terms of specific incidents that had made a difference for children in understanding those things through narrative, storytelling, and eventually role play and drama. And then we used more traditional research activities like focus groups, semi-structured interviews with both children and adults, which included the collection of case studies, key informants with government and community leaders, observation. And while we were hoping to use technology in terms of mobile phone mapping, that wasn't unfortunately possible due to a number of limitations and challenges. The research builds on earlier experience of Columbia University through the CPCLN and IICRD in experiential participatory monitoring and evaluation approaches to work with young people. And through IICRD, that's reflected in our CAPE set of tools. And we were also very honored and pleased to be able to draw on Mike Wessel's experience looking at community mechanisms, child protection mechanisms, including and specifically focusing on things like child protection committees and the role of committees in addressing vulnerability. The implications of this for the work in both countries included really understanding children's own perspectives on vulnerability. And if you look at these two slides, the one on the left is in Cambodia, the one on the right in DRC, in using a variety of means to see risk and protection through the eyes of children, and particularly vulnerable children, and then to better understand that in terms of vulnerability in relation to resilience and protection, and how this was having an influence on children's ability to access protection programs, and World Vision's capacity then to design their programs specifically based on that information and to work with communities in a more holistic way. So looking at children as the experts in this process and using participatory engagement, including data analysis. We used a purposive sampling strategy that worked with groups of children, typically between 10 to 20, ideally trying to include some children who World Vision already knew of as being vulnerable or who were experiencing risk. And this included children living in extreme poverty, working children, and other groups in the DRC. We also did some work with girls experiencing commercial sexual exploitation in the inappropriately named Maison de Tolérance, which are local brothels in communities, and we also worked with street children. And in as many situations as possible, we tried to reach children who were not part of World Vision's programs as well. So Mike and I conducted case study interviews with children who were not included based on information that we gathered, usually from the children who were in the programs, who knew about children who were excluded, but those children were not able to join. We worked, as I mentioned earlier, with the child protection committees through CBOs and women's groups and other organizations, including committees that World Vision had structured, as well as other government structures. Typically, as I mentioned at the beginning, social welfare officers and other protection duty bearers, including police, teachers, and others. And in the context of the conflict setting, we worked with UNICEF and MONUSCO as the UN agencies responsible for the children affected by the war in Eastern DRC. And finally, there was a very rich learning association with the World Vision local staff to engage them in their perspectives on protection and risk. The focus groups with the adults were very much drawing on the research that Mike had collected through the investigation on community-based child protection mechanisms, and here we were particularly focusing on that relationship between government and community. The initial findings from the literature echoed many of the themes coming through from the field research, and one of the ones that came up immediately was the challenge in defining vulnerability and moving from a group-based emphasis on vulnerability that would focus, for example, on children with disabilities, or an emphasis in regards to the slide on the right, children affected by conflict, and would typically lump those groups of children together irrespective of their levels or experience of vulnerability, and a challenge in moving away from that to focus more on specific risk factors in children's lives. So while every child in conflict is affected by the conflict, some children will be more affected, and that might be because girls are at risk of sexual violation, or boys are at risk of being conscripted into armed activities. And so looking at these specific risk factors in relation to protection was something that was identified as a challenge in the literature. And then laddering this into programming experience. One of the great issues that came up, and I'm sure many people will resonate with this, was the ongoing challenge of meaningful participation of children in child protection program activities, and even above and beyond that in program design and monitoring and evaluation. And I don't think this is just a challenge for World Vision. I think it's a challenge for all agencies today, and we welcome questions and comments on that when we get to the discussion. Engaging with cultural and social norms was identified as something that is clearly at the heart of child protection, and especially because child protection typically focuses on the dark side of human behavior and the need to better understand cultural and social norms in relation to not only risk factors but also opportunities. And this came up frequently in the literature findings and in the research. And finally, the protection workers' potential for bias based on their beliefs and the way this can influence an emphasis on certain children over others in communities. And the slide on the right is again from DRC and shows a young man with a physical disability. And actually one of the areas that World Vision had made great progress on was including children with physical disabilities. But sometimes we found that led to an exclusion of children whose risk factors were more hidden. For example, girls working in domestic labor. Evidence gaps came up as another challenge in the literature, and an interesting area that we identified in both the literature and the field research was an inability to bridge the worlds of OVC, so Orphans and Vulnerable Care, and MVC, and I think we saw a real push and a lot of progress being made to better understand risk and protective factors in relation to OVC in the 1990s and the first decade of this millennium. And some of that information is not being carried over now into the emphasis on violence against children and the new focus on system strengthening. And I think this is a very interesting and challenging gap, not only in the literature, but in the practice. And finally, a gap was identified in terms of a lack of participatory monitoring and evaluation tools that engage children. Moving to the field-based findings in terms of inclusion, what we found in the context of the three countries particularly is that World Vision was making actually great progress in including many vulnerable children, including children who had suffered abuse, children with a disability. The photograph that you can see is a picture of children who do not have hearing in Beni, and they were very actively engaged in not only the programs but the research that we led in Beni, and had many important insights to share, not only about their own challenges but the challenges of other vulnerable children in the communities. Other groups including children who had to drop out of school and children who were threatened or were forced into early marriage. We also found in the research in terms of inclusion that there were gains made by World Vision specifically because of their positive experience in working with government and the transfer of skills and logistical support to government that assisted government workers better able to meet their job demands in terms of reaching out to children and supporting children's referral through the child protection system. And there were exemplary examples of the role of the child protection committees particularly, and the role that committees were playing in linking vulnerable children and their families with government support and services. There was also some very interesting work, and we may be able to come back to this later on, in the Eastern DRC on World Vision's use of a systems approach, particularly a non-formal systems approach in fragile contexts. And I think this is interesting because there still tends to be an emphasis quite often in humanitarian settings on very narrow sectoral interventions like child-safe spaces, and an assumption that you can't use systems approaches in humanitarian settings. And we actually saw in Beni that they were being used in very creative ways. In regards to impact, we found that in discussions with children and their families, they did feel that there was a very clear impact, and this came out particularly through the River of Life most significant change stories in terms of altered behavior in community. The photograph on the left is of a mother in just outside of Beni with her young son Moses, who was an abandoned child, and what we saw in Beni was change in behavior in which abandoned children were clearly being better integrated and adopted by families in ways that weren't happening in the past. Similarly, we found change in behavior in regards to reduction in domestic violence and greater support and appreciation for children with disabilities. Children were being registered in greater numbers through the child protection committees, and were able to access services where they existed, and I'll come back to this later on because that was a challenge. And where they didn't exist, communities were coming up to their own solutions for both addressing the needs of children, for example, trauma, through local counseling, and drawing more on endogenous local healing traditions, which I'll speak to in a moment also, and Mike can probably come back to this also. And over time, I think, and this is an important issue, we did find that the child protection committees were moving away from this lumping children together in terms of thinking, you know, all street children were vulnerable, to really focusing more deeply on the root causes, typically including things like poverty, discrimination, and some of those factors we talked about earlier on. Some of the barriers to inclusion. We did find that there were still many vulnerable children who were not able to access child protection programs, particularly due to some of these root causes. Severe poverty would be one. Weak government would be another one, where there just aren't services available and communities didn't have the resources to support those children. And conflict in the case of the DRC. There were some children who were especially at risk who were not able to access programs, and this included children and girls particularly involved in commercial sexual exploitation in the DRC. The boys had been conscripted as soldiers and had no space for their own agency and participation. Street children and migrant children. And the slide in the top right is a photograph of a young Maasai boy who typically would have to migrate with the goats in this picture, or cattle, for weeks at a time, would have to drop out of school, and because they were absent from communities, couldn't participate in things like children's clubs or access caring adults, because they were literally outside of the community and quite far away in very dangerous circumstances, quite often encountering wild animals or adults who might be a threat to them. And that relates to the final point about the children living in remote rural communities. Slide on the bottom is one of street children in Beni, and I'll come back to the issue of street children in a moment. There were many innovative ways that children were caring for themselves and their peers. The slide at the bottom is actually an example of the River of Life activity, and you can see we're mapping all the specific activities that World Vision had led. And in these activities, children came up with many examples and later presented them as skits and plays in terms of creative ways that they were protecting themselves. For example, a girl with a disability supporting children without a disability being able to access schools. Children identifying girls who might be at risk of early marriage and identifying those children to their child protection committee or to the appropriate government authorities as being at risk, and the government intervening and being able to protect them, or even children and adults coming up with innovative solutions like registering children so that they had a certificate that said how old they are, so they could say, you know, I'm only 14 years old, it's against the law to marry me, which is often a challenge in early marriage because children can't prove how old they are. World Vision had focused quite extensively on using life skills as an entry point to working with children through their Peace Road curriculum, and we found that emphasis on life skills played a very critical role in giving children tangible tools like tools that would help them build their self-esteem, be able to speak in public, improving their communication, tools that sometimes just made a very critical difference because they were able to improve their economic situation and help them and their families rise out of poverty enough that the risk factors became less of an issue. And we looked closely at who then the natural allies were for children in terms of local adults, and frequently children would speak about the role of traditional leaders, the chiefs, a teacher at school, and the role of their children's clubs and the work that World Vision staff were playing. We did look, as I mentioned earlier, at more deeply at children who weren't able to access services, and we carried out extensive research with children involved in migration. The top slide shows girls in Cambodia who had migrated to Malaysia and had been exploited as a result of that migration. And clearly in this example, these were situations where girls were not able to access services because, again, they weren't in the community. But we wanted to better understand what were the push factors that resulted in those girls having to leave in the first place, and particularly focused on some of the economic and social exclusion issues. One thing finally from that last slide was to focus also on the pathways that children were using where they could to access services, and also looking at where those pathways weren't working. One of the things that came to light immediately is that many children don't go to adults because they don't trust adult-oriented services or they don't know they exist. Some of the challenges that we identified was the disconnect between some of the self-protection strategies that children were using, for example, sensitizing people to protection issues and to their rights, and the fact that some of the risk factors were just too large for those self-protection strategies to address. So, for example, a child abducted into the conflict in northern Kivu may not be able to resist abduction because of sensitization. You need more government support and advocacy and intervention. Similarly, with girls going into the child brothels, sensitization enough is not alone. Quite a few adults were still not understanding the complexity of vulnerability patterning in terms of the risk factors. And one of the reasons for this is that many of the most vulnerable children were still not involved in the children's club, so there wasn't an opportunity for adults to really listen to children and find out more about the origins of and the roots of their protection needs. And there was still a tendency often to focus on some of these superficial traits of groups. So, for example, domestic violence or street children, and not understand some of the deeper risk issues underneath these things. And one of the biggest challenges that came up was the lack of referral services, and communities might be able to identify children who were at risk, but frequently there just weren't the services to care for those children in the communities. And we heard many heart-wrenching stories of children who'd been identified of sexual abuse, for example, and ended up living with the NGO workers because there was nowhere else for them to go. They couldn't be reabsorbed into the community. What are some of the opportunities that we saw for World Vision? And we would welcome feedback from both World Vision and other colleagues on the line in terms of strategies that are being used. Well, clearly, children in their communities can be a potent force for child protection interventions when they're engaged in the right kind of way, in both identification, referral, monitoring, and other aspects of protection. Within World Vision, we were interested in the broader economic role that area development programs played, and we saw that there were some very compelling evidence in terms of the link between poverty alleviation outside of child protection programs and the way things like food security and other economic interventions supported protection interventions, so looking at social protection in relation to child protection. And I mentioned the fragile context situation in the DRC and the opportunity for a systems approach. And that's something that I think World Vision is beginning to roll out now, is looking systemically at the situation of children in conflict. Moving to the final stage of the presentation before Mike and Andy take over, there were a series of recommendations, and I'll quickly go through them. One of them is to address this issue of definitional challenges. And we came to the conclusion in the end that this dichotomy between groups of children versus risk and protection factors is probably a false dichotomy, and that you can actually approach child protection including both perspectives. And our suggestion to World Vision is to begin conversations in community in ways that do build on people's natural inclination to identify groups, so children suffering from violence, neglected children, etc. And World Vision does this within their ADAPT strategy, which is quite similar to PLAN's CCCD, Child-Centered Community Development Approach. So begin by focusing on groups, but then to engage children and adults in deeper discussions to look at what are the risk factors that result in children ending up in those groups, in those situations, and how do they change across the lifespan. Not all children are born into a vulnerability. Vulnerability can shift as children move through adolescence or mid-childhood, and to engage communities in why that's happening and how that relates. And finally, to take an ecological approach in better understanding these things with community that looks at the relationship and the patterning of risk and protection. We recommended to World Vision that barriers be better understood in terms of why some of these groups couldn't access services, and we've talked quite a bit about that already, and that the life skill program particularly be further enhanced to equip children with tools that could allow them to participate, or to look more systemically at reasons why children were being excluded, and to work with government to reduce those higher level problematic challenges that run much deeper. We had a series of recommendations that focused on participation to provide more meaningful, safe opportunities for children to participate. I've already spoke about the lifespan approach, and that was one of our suggestions, that quite often participation within NGOs begins with youth or with adolescents, and we suggested that this could start much earlier with families with young children, so that by the time children become adolescents or youth, participation is a much more ingrained way of engaging with not only NGOs but with government and community in general. And we suggested also that in the context of most vulnerable children, World Vision develops specialized capacity to manage the unique needs of most vulnerable children, because if you're looking at street children, for example, or children involved in drug use or misuse, often there's very high levels of mistrust towards adults and the systems that are there to protect them, and so practitioners need specific skills, and this is where research and practice, I think, come together in a very powerful way to identify those needs through research, and then to translate that knowledge into better practice in ways that can enhance children's well-being and overall protection. We have a series of recommendations focusing on cultural and social norms. One is to build on the strengths of the program as they exist already, particularly in terms of in the Maasai community, where we worked in Tanzania to look at why very long-standing Maasai traditions of early marriage have been quite successfully shifted within a very short period of time, and to build on that success, and to do this in terms of bottom-up systems change. And similarly, to look at where there may be unintended negative patterns of cultural shifting norms. For example, we found in the same communities that whereas FGM with teenagers had gone down, female genital mutilation, that some families were cutting children as soon as they were born, and that there'd been a shift in the risk factors from older children to younger children. So to look at this aspect of unintended harm in terms of CP interventions. Looking much more deeply at the endogenous practices. I mentioned the Maasai example already, but where are there strengths and cultures that can be built upon? And one of them clearly with World Vision is the focus on compassion in relation to faith-based interventions, and to work closely with communities to look at this aspect of community ownership. And hopefully Mike can speak about this when he comes to it, because it's built very much on Mike's interagency research in East and West Africa. And finally, in relation to the gaps in evidence, to look at more of a bottom-up approach that more closely ties research and evidence approaches such as this one to strengthening practice and to involve practitioners in this process as well as research. And I'd like to finish on that slide, and we have the web links here to the final reports. I'd also like to, in conclusion, again, thank World Vision for the opportunity of working together. It's been a real pleasure to work with Andrew and the colleagues in the 3 countries. And if people are interested, Mike and I are leading a subsequent stage of this research that's focusing on unrolling a theory of change that specifically focuses on systems strengthening for non-formal, formal aspects of child protection, and we'd be happy to share some of that work as well. Thank you, Mark, and at this point I'll pass over to Mike.
Thank you, Philip. I hope everyone can hear me okay. I wanted to begin by just saying what a pleasure it's been to collaborate with Philip, and how much I have learned through our collaboration, and also our collaboration with World Vision on this important process of learning. I have just a couple of small comments that I wanted to offer, sort of bringing this up a little bit to the sectoral perspective. I think across the child protection sector, we've all been collectively struggling with this issue of how do we engage with the most vulnerable children. You know, so many of our most frequently used interventions, like child-friendly spaces, are extremely valuable and reach large numbers of children, but we know that there are limitations in how well they include some of the most vulnerable. Children, for example, who work in diamond mines or, you know, brick factories or any number of other pursuits are not able to participate in venues like child-friendly spaces. And I think that as a sector, we haven't necessarily done due diligence, myself included, in terms of developing program and practice modalities that are better suited towards reaching out. So when viewed in this context, I think this entire process has been terribly important. And I'd like to humbly suggest that what we all need to be doing is to develop specific approaches for reaching most vulnerable children, and to be more intentional in our efforts to reach out and include. I also wanted to mention that this research, I think, really drives home the important message that in strengthening wider child protection systems, it's really important to take a multi-sectoral approach. So Philip, for example, has highlighted some of the key findings underscoring the importance of linking child protection and well-being with things like social protection. And I think we also found, you know, some important linkages with education. And certainly in issues like the Ebola crisis in West Africa at present, we're seeing the health implications coming in. So what this means is that even though we are all very keen, I think, on strengthening social services and natural supports and child protection supports, as we've sort of more conventionally focused on them within the child protection sector, we really have to be much more broad-minded and multi-sectoral in our approach, reaching across many different sectors. And as Philip said, when we talk about most vulnerable children, it's profoundly important to ask, who is it who defines vulnerability? Oftentimes our sector has been limited by focus on our preconceptions as child protection specialists. And those are valuable, and I wouldn't say that we should suggest that we should somehow set them aside entirely. But I think the value of the approach in this research was through engaging in a process of grounded learning and starting with children's own understandings of vulnerability, which were then triangulated by talking with other people and trying to enrich that understanding. When it's done in that way, I think communities feel listened to, one takes a grounded approach, and local people feel respected. And this a subtext of this work is that the way in which we learn begins to influence the levels of community ownership for the process of using the learning and of engaging themselves in practice to protect children. So the level of community ownership, I would argue, begins with the ways in which we learn and conduct assessments, and do we feed that information back to communities in respectful ways that communities can then use to organize their own action. I also wanted to mention a couple of do no harm issues because they're omnipresent, given all the complexities of our work on child protection. It is easy in trying to reach out to highly vulnerable children to tacitly stigmatize them, or perhaps to raise expectations, or even possibly to make them feel badly that they haven't been able to participate in program modalities that are enjoyed by other children. All of those problems and the many others that I'm sure the experts who are called in participating on this conversation today can identify, all of those are addressable. So I'm not pushing a panic button that is aimed at paralysis. It is much more saying that when we do this work, we need to work with heightened sensitivities, with deep empathy, and to reach out in ways that are really appropriate and that will manage these do no harm issues. And I wanted to just close by thanking World Vision for this tremendous learning opportunity. I think the work so far has really identified the agency and power of children's views and voices, and also the strength of community and family processes in protecting children. And now World Vision is beginning to give us some new information on how to link those through a bottom-up process with aspects of the formal system in ways that entail some real community ownership. And so I just wanted to say a big thanks to World Vision on that note. And with that, I will hand off to Andy Ware.
Oh, Andrew Ware here from World Vision. So we were extremely pleased to partner with Philip Cook and Mike Wessels in this research as rightly recognised as experts in this field. And we, right from the outset, we wanted a participatory and empowering approach to this research, and we're very pleased that they met the brief extremely well. And I was privileged to join in the research in DRC and experience this firsthand. It was truly a positive, empowering experience for the children and young people who were involved. One of the things the research confirmed to us was the power of children's agency to advocate for themselves and also for others, as some of the examples Philip has shared. But it also surprised us with examples of children choosing not to participate for various reasons, as well as where they were unable to participate. The research also helped us greatly to flesh out our understanding of children's vulnerability and the barriers to their participation, and also with some tools to reduce these barriers, although these do require further work. The research also raised the challenge, which has been referred to, of identifying and targeting the most vulnerable of all children, ensuring those children are included and impacted from our programming. And this is a particular challenge when, like many others in the sector, we have embraced the holistic system strengthening approach to child protection rather than the sort of old-fashioned issues-based approach. This is something we've started working on and thinking about, and as a first start, we have produced a plain English version of the research with guidelines for our field offices, our national offices, to use. Then finally, we felt that the research demonstrated a far wider and deeper evidence of impact on most vulnerable children from adopting this child protection system strengthening approach, and the broader work in this field, which is, as Mike's just said, is multi-sectoral, involving both formal government child protection systems and structures, but also a multitude of informal and traditional structures, including faith leaders, traditional leaders, and so on. And this is proving to be protecting many more vulnerable children who are not directly involved in the program, but they are being protected through a stronger child protection system and protective environment around those that much larger group of children. So that's my attempt as a brief summary of the research. And as part of the World Vision family, we're pleased that Philip and Mike are continuing their engagement with us in exploring and testing our theory of change for child protection. So we look forward to continued engagement and fruit from ongoing research. So thank you very much, everyone, for your time in listening to this webinar. Thank you.
Thank you very much, Philip, Mike, and Andrew. That is a lot of food for thought, and we already have a lot of questions streaming in, and I would please advise the attendees, if you do have questions, try to get them in now, as we will spend, somewhere between 10 and 20 minutes, probably closer to the latter, taking questions, but given the question lineup, it's likely that we're only going to get to the ones that are submitted now, and the others we can try to answer by email with the panelists. Thanks again to the presenters. I've tried to regroup the questions that have already come through into 3 categories. The first one is about how this emphasis on most vulnerable children integrates with a systems approach to child protection programming. One of the participants noted that you gave the example of Bainey, Philip, and was hoping that you could elaborate what are creative ways to integrate and to use a systems approach in reaching most vulnerable children. So maybe just a little bit more about that example would be wonderful. There are a couple of questions about methods. Hazel Nyathi has asked if the research clearly disaggregated vulnerabilities in urban versus rural settings. And Barbara B. has asked how you, as the researchers, were able to engage most vulnerable children, such as those with mental disabilities. Barbara notes that there's a tendency to include those who are slightly better off than others, and that it always leaves out extremely vulnerable categories such as children with mental disabilities. So what efforts were made? And you certainly touched on that, Philip, but maybe a little bit more about the inclusion of such groups of children. And finally, a couple of questions on participation. One attendee, Ku Thirith, and my apologies in advance for my pronunciation, from World Vision Cambodia, has asked 2 questions. First, could you give more detail about the gap in participatory M&E approaches? And I know, Philip, you have a lot of wisdom to share on that topic, and we'll be able to point listeners in the right direction. And secondly, in Cambodia, they have also face the challenge of limited involvement of the most vulnerable children in children's clubs. Were there any recommendations specific to including most vulnerable children in these structured participatory activities? So I think we can just let the 3 of you answer in the same order that you presented in, and then go to a second round of questions before we wrap up.
Sure. Well, those are all great questions. Thank you, Mark, and thank you for those who've sent them in. And we could obviously speak at length for each of those, so I'll try and be brief in my responses. I think the systems question is a really great one, leading off. And one of the things that I think we all realize working in communities is there are rich systems that exist in every community. So often we assume that systems are things that governments introduce, without realizing to use the word that Mike uses quite often, that there are clearly endogenous systems. So societies have evolved their own ways of managing risk, of looking at healing after shocks or after people have suffered trauma. There are systems for resolving disputes. There are child rearing systems that exist in communities, and there are systems that children, there's interesting systems within childhood, games and other activities that children engage in. And so I think one of the pressing needs in the sector as we advance our thinking on system strengthening, as Andy was pointing out, as we move from an issue-based to a systems focus, is to better map and understand the systems that exist in a community as we're developing and strengthening the government systems, and to see where those things link up nicely, and sometimes they do, and also to see where the systems don't connect. And this is where child protection mechanisms like committees can play a very important role, because they straddle both systems. And I think when committees work, and there's other mechanisms obviously that we could be using, youth clubs and other non-formal, women's societies and traditional societies, but to look then at how those mechanisms can intersect. In Beni, in conflict-affected societies, what we saw is that in the absence quite often of government systems because of the conflict, there were some government systems, but they were quite weak, obviously, or fragmented. Because of the conflict, we found that there was, unfortunately, sometimes on behalf of child protection workers, a lack of understanding of the existing systems that were in place. So healing mechanisms, that we did find through the research that there was psychosocial support being offered to girls in the Kije, the child brothels, that practitioners weren't aware enough. So to be able to build on that type of psychosocial support, children were assisting each other to avoid risky places. So we found through the River of Life activity that as a result of the life skills, children had themselves identified risky places in the community where boys were being abducted to fight in the armed forces or to work in artisanal mines, the informal mining sector. And the children were warning each other and recommending that kids don't go there. So those are systems that were in place. There were adoption systems where mothers were taking in abandoned children, like the image of Moses that I showed. And so I think a next step in our systems understanding, whether it's a developmental or humanitarian context, is to better understand the richness of systems, both in terms of their assets and their risks, and to be able to link up each system through specific mechanisms like committees, youth clubs, etc. On the research methods and the focus on rural versus urban, yeah, that was a really important consideration, and I haven't spoken about it very much. We did look at this particularly in Cambodia, and comparing risk and protective factors in Phnom Penh versus Phapak, which was the other community where we worked. And in Tanzania, we compared an urban slum community in Dar es Salaam with a very rural traditional Maasai community, Kitambeni, close to the Kenyan border. And there are clear differences in terms of risk and protective factors that the methods identified. For example, more children who were displaced in urban settings, also more resources quite often in urban settings, so more opportunities for accessing that multidisciplinary intersectoral web of support that Mike was speaking about, compared with rural communities. However, in rural communities, there was often a stronger sense of community that could be built upon through the child protection committees. I'll let Mike perhaps come back to that again, because he was very involved in some of that rural versus urban comparative research. In terms of the children with mental disabilities, I'm really glad you asked that, because this was a group of children who were almost in every setting the most vulnerable, and I should have mentioned it today, so thank you for flagging it. You're absolutely right. I think you were suggesting that in the context of disability, often children with mobility challenges are identified more quickly, say, than children with a mental disability. So a child with cerebral palsy, for example, who might be kept at home and not allowed out, or children with psychosocial trauma issues who find it harder to function in typical community settings. And this was one area that we suggested to World Vision where more progress could be made, and I think it's really important within the sector. I don't think this issue gets enough attention. We did find that children were being very compassionate in reaching out to some of those children, but there needed to clearly be many more opportunities for their inclusion, which leads to the final question on participation. And yes, big gap in monitoring and evaluation. I think just the basic monitoring and evaluation in child protection is an area requiring further strength, and this is one of the dimensions of the theory of change research with World Vision that we're now conducting, is to help strengthen, well, for World Vision it's DM&E, but monitoring and evaluation practice, so that there's a better interweaving of quantitative and qualitative data. And then I think within that to look at how children can be more meaningfully involved in monitoring and evaluation, so not just recipients of program support, but being more partners in program design. And this is a very nascent area within the sector. I think there are some examples of good practice, but not very many. And we and others have developed specific child-centered monitoring and evaluation tools. Many of the tools that were used in this research come from an initiative that we led called CAPE, Child-Centered Accountability, Protection, Evaluation. And if people are interested, those tools are on our website, and I'd be happy to answer or engage in email or other conversation on that. And Mike and others, Mark included, have a lot of experience there. And finally, in the children's clubs and how that factored into children's participation and those who've been excluded and where opportunities could be made. In some instances, it was a matter of rejigging the timing of a children's club, for example, because in instances some children couldn't participate because they were happening at a time when they were working. So it might have been changing the hours or having a more flexible system so that working children could participate. But as Andy rightly pointed out, one of the interesting findings in terms of children's agency was that some children just didn't want to join the club because they had other priorities that they felt were more pressing, such as earning an income, or they had to migrate, or there were other issues. And that, I think, is a deeper discussion in terms of how we can create greater social space for children to engage in ways that work for them. And children's clubs may not be the only answer to that. There might be other opportunities and types of interventions and mechanisms that we would need to use to engage those children. But I'll stop there and hand over to Mike and Andy.
Thank you, Philip. I just wanted to chime in just a little bit on that last point. I think it might be useful to have children actually define the modalities. In the NGO sector, it has been pretty much the child protection workers and adults who define most of the kind of practice modalities. But for children who are migrating, for example, or children working in brick factories or whatever, if their interest is in making money and solving problems of how to survive along a migration route that poses various dangers, why not invite them to think about ways that children could support each other, and where those suggested ways are appropriate, why not support them in doing that? In other words, they would actually, the children themselves would actually define the modality, and we would be learning from and supporting them as they go. Coming back to the second question on the urban-rural distinction, I agree that a big problem was that in the rural areas we found that there were stronger traditional structures and processes, and that meant that there was relatively well-defined practices and leaders and roles and so on, and we tended to find that less in the urban settings. So there, I think what we need to be doing is two things. When we work in the rural areas, we need to start with deeper learning about what's already there, as Philip and Andy have already said. And then secondly, in the urban areas, we need to work in a way that actually aims to increase social cohesion, because that's often what's broken down or missing is, people are coming together who have not traditionally been together and may represent different ethnic groups and so on. And on this systems approach, I'd humbly suggest that maybe what we all need to do is to judge systems strengthening efforts not by how well they do for the children who are better off, but look specifically at how well they do for the most vulnerable children. It's kind of a social justice lens to use in examining the efficacy of systems, but I think it's really terribly important. And like Philip, my guess is that when we do, we'll find that an awful lot of supports are endogenous. And there what we need to be doing, I think, is working in a concerted way to develop effective partnerships between and alignment of the non-formal processes and the ones that are more formal, whether it's done through collaborative dialogues or MOUs or however it's done. And then the key is to, I think, to have community ownership in those things. If it's all top-down, driven by the government, then I think there are low levels of ownership. So at the end of the day, we want high levels of community ownership, keen sensitivity for most vulnerable children, and real respect for the local practices, the endogenous practices, the ones that are helpful, and then support them through linkages with the formal system that are community driven. Thank you.
I'm not sure if Andrew wanted to reply. Yeah.
Yeah, I'll try and be brief because I think Philip and Mike have answered those questions extremely well. So just on the first question, I would just point out that in this PPA program in particular, we've put an emphasis on inclusion of most vulnerable children right from the very start in our initial engagements with our partner national offices. And our ADAPT assessment approach emphasizes the importance of raising awareness of most vulnerable children and identifying those children within communities, and actually communities, children and community members themselves identifying those children. And then also through our monitoring and evaluation, we have again in the PPA program stipulated disaggregation not just by gender but also by disability as a means to at least identify one particular group of vulnerable children, and also with targets for numbers, percentages of children with disabilities actually engaged in the program. I don't really have any more to say on the urban-rural question. I completely agree that children with mental disabilities are a group that are particularly neglected, and was pleased that Philip in particular went to great lengths to engage those children where he was able to find them. And just also was to point out that in our baseline we use the Washington Group questions to help identify children with mental disabilities alongside those with various forms of physical disability. In terms of gaps, I think it's important to identify. It's important to recognise that children are very little involved in monitoring and evaluation, and this is a great deal more work on our part. Training of staff, I think, is key here because this was another really positive spin-off, actually, from the research, was that staff were involved alongside Philip and Mike, and they learnt an awful lot from them, and now feel empowered and equipped to be able to engage and involve children in monitoring and evaluation in their programs. And then finally, just on children's clubs, I would just say, in addition to Philip's points, let's get away from just having children's clubs that are linked to schools, because that's the easy, soft option. And one initiative we've taken to do this is, as part of the PPA funding, we have updated World Vision's Peace Road curriculum to make it much more accessible to children out of school, so that clubs and groups can be formed in less formal settings and be accessed by children of low literacy or even no literacy, with new methods for sort of recording their progress and their feelings and responses and so on in going through that curriculum.
Wonderful. Thank you, Andrew. Those are important clarifications. And I think I thought all of those answers were really thoughtful and really helped us to dig deeper on some of the issues. We have a second round of about 8 questions, and unfortunately I don't think we're going to get to all of them, so I'm going to focus on some of the bigger ones. Before getting to them, I want to just pull out the adjectives that people have used in responding and in asking their questions. They have found this webinar to be rich, reflective, interesting, important, wonderful, excellent, and inspiring. So well done to Philip, Mike, and Andrew for inspiring people and really getting us thinking. For our last round of questions, and we'll have about 10 minutes to answer these, the themes that we'll focus on are government, gender, and program approaches. On the first, on government, Manuel Manrique has asked, could you make reference to the role of government for existing regulations or policies? Do these make any difference? Given that governments are quite weak in many of the places where we work, who establishes ways to deal with this reality beyond World Vision's, or I would say any organization's contributions through its own programming? A very deep, profound, and I would even say philosophical question about the relationship between NGOs and governments in fragile and other settings. On gender, Mark Laurie from World Vision International has a brief question. Could you speak to the key gender differences that emerged in the research, perhaps in terms of risk and protective factors? And finally, a group of questions around program approaches. Innocent asks, is World Vision applying case management practices to inform integrated intervention plans for most vulnerable children, keeping in mind the uniqueness of each individual child and addressing barriers for the most vulnerable children who have been excluded by systems? Florence Martin asks if the research and the programs that it focused on explored the role of families and family-focused approaches. And finally, Alistair Ager, I'm guessing, a professor here at Columbia, was interested in the comments regarding vulnerability and access to safe spaces. His own work on impact evaluation of child-friendly spaces, mostly run by World Vision, has shown generally that vulnerable children, variously defined in local contexts, are no more or no less likely to attend activities than vulnerable children. Than other children. In the context of this work on the most vulnerable, how do you view the finding of Alistair's work? Is it good enough, or should community and population-focused interventions demonstrate a particularly strong reach for the most vulnerable? A couple of you had asked questions that we're just not going to get to, but you see the IICRD website there on which you can find Philip's contact information, and you can also find Mike Wessels on the Columbia University webpage. And I would have, if you are very keen to have a couple of remaining questions answered, I would recommend that you reach out to them. And with no further ado, over to Philip, Mike, and Andrew for one final round.
Mm-hmm. Well, another round of great questions. Thank you. And I'll start with Manuel. Hola, Manuel. And the question on governance or governments, and actually those two things I think are intertwined in terms of the role of government and the ways in which governance affect these interventions and the responsibility of duty bearers. And yes, clearly there is a key role for government in all of this as the ultimate duty bearer when it comes to the responsibility to implement child protection services. And so I think there's a spectrum that we need to consider across which governments play a role. I mean, initially government was not focusing on child protection, and I think we need to highlight this point that protection is really a latecomer to children's services. Sectors like health and education have a lot more experience, and I think this both provides challenges in terms of the lack of awareness that we flagged at the community level and lack of awareness in government on how to address protection, and it's also an opportunity, I think, for government to do things differently than, say, has been the case with the older sectors of health and education. And by doing things differently, I would say the need for government to really work in greater partnership, as Mike was saying earlier, with communities, for governments not to assume that they know what's best for children always, or that they are the only agent responsible for children's best interests, but to better understand this rich context at the local level, whether it is in an urban or a rural setting, and to work from that context, and perhaps to play more of a facilitation role in linking existing resources with their own resources, and to see where government can play the best role, whether that's to establish child protection systems, to look at protection within other sectors. So clearly education has a very important role to play, or health, as Mike was flagging in the context not only of Ebola, but of sexual violence and other health-related protection issues, and to adapt their services accordingly, recognizing also in relation to social protection the important role that government can play in poverty alleviation. And we did see some quite striking examples of that in Tanzania, for example, where there was some use of cash transfers to support children, or to support families rather, rise out of poverty. And I would say in Latin America, although we haven't spoken about it today, there's very rich experience in social protection, and Manuel knows a lot about this in terms of how governments have taken a much broader focus on integral protection measures that can lift whole communities out of poverty and reduce protection risks for children through that process. The gender question, again, that's obviously one that we could and probably should talk at much more length about. Yes, there were some clear differences between girls and boys. The issues of sexual violence that I've flagged, and some of this was culturally determined and patterned. So, for example, we found in Cambodia, and I think this is true for quite a few Southeast Asian countries, especially those in the Mekong sub-region, that there's long-standing traditions of girls supporting their families and having to leave home to support families, and whereas in the past this might have been to go to a neighboring village and work with extended family and send the remittances home, what we're now seeing is that girls have to travel much longer distances, and that subsequently increases their risk to trafficking and exploitation when they reach their destination, as was the case with the girls in Myanmar. I think we see different risks for boys, so the cattle herding risk factors that I mentioned with regards to the Maasai youth, boys engaging in conflict or being conscripted into conflict, certain hazardous labor conditions like the artisanal mining, the coltan mining in DRC would be examples where those risks are different for boys. And then there's some risks that are probably the same for both groups of children, certain risks in terms of the influence of domestic violence on children, sort of broader risk factors associated with conflict, etc. Perhaps I'll let Mike come back to this because he has a lot of experience, and Andy. Alistair also, Paul and other colleagues, great questions. Yeah, case management, yes. This was an area actually where World Vision was assisting government in providing tools not only for World Vision staff but for government in better taking on the responsibility for case management. So in identifying, often through the community committees, where the committees would identify vulnerable children and they would assist in the case management, working with government, and in serious cases government would take it on, or in some cases where it was an infraction of criminal law, the police would be brought in, so sexual violence, for example, and the police and social welfare would work together in terms of case management. And that was often a very important part of the training that World Vision was providing, was in strengthening the case management and referral system and support. Because as I mentioned, one of the great challenges with case management in many communities where we did the research was you could identify children and refer them, but there often weren't the supports then to manage their risk and to enhance existing protective factors. And I think this is a gap that the research identified, where communities can take on some of those things, and you can be creative in regards to some of the examples we've provided in relation to things like psychosocial support, but there are limitations to the extent that community can manage some of these cases. And I think this whole area of rehabilitation and reintegration is one that's really ripe for a much deeper reflection in terms of how we manage some of these very serious cases and the extent of communities' capacities and the way government needs to be equipped to take this on beyond just looking at institutionalization of children and warehousing children, which we know is not in their best interest. The question on families is a really good one, I think, also because I think if we're really serious about this whole aspect of non-formal, formal systems change, families need to be at the center of that whole process. And I think this often slips off the radar screen for those of us working in the child protection sector. You know, and I'm as guilty of this as anyone, where we tend to focus often very exclusively on children without truly understanding the importance of families as the greatest non-formal support, or the importance of the family in informal support for children. And there were some really interesting, innovative examples in this research of World Vision introducing mechanisms. So, for example, family agreements in the context of domestic violence, which was like an informal agreement that had a quasi-judicial legitimacy, which World Vision staff with community protection workers would set up with families to monitor domestic violence and to work with families as the unit of intervention with children. We could talk a lot more about the importance of families. And Alistair, also great question on safe spaces, and I think your research with World Vision on safe spaces is so important in this context to look at what's working and what's not working. And I was interested in your question. Actually, I wish we could have you speak in this conversation because you have so much to say on this. But I think this is, again, an area where we need to go back to Mike's comment or Andy's suggestion also, that this is clearly an area where we need to work with children to better identify this whole issue of what is in fact safety for them, what's manageable in terms of safety, where are the safest places for children. You know, that could change during the day. We've been involved in extensive research with sexually exploited children, and often with them it's issues around things in the middle of the night, and where they can be safe at nighttime, which may be quite different during the day. In post-conflict communities, children might have very different understandings of a safe place compared with adults, and in the rush of intervention in humanitarian contexts, it's easy to not engage with children in a way that allows their experience and suggestions and wisdom to come to the surface in this. So I'm sorry, that's a very brief response to your questions. I think they could use a lot more unpacking, but I hope that's at least flagged some of the issues.
This is Mike, and maybe I could come in as well. On Manuel's question about the role of government, I think this is in some ways the $64,000 question, but I think there's been perhaps too much emphasis by government on forming regulations, and maybe not enough thinking by government and even by civil society on how to engage communities and civil society organizations in the process of governance. I mean, in so many areas, rural areas in particular, people feel quite marginalized. They may feel the government, has not had them in their interests at heart. And what we need there, I think, is a process of bottom-up system strengthening to complement the top-down. And what that does is it begins a process of having local people cooperate with government on taking ownership for protecting children, and it becomes in the interest of communities to actually use formal systems and maybe help enforce some of those regulations. On Mark's important question, I just wanted to flag that early marriage also surfaced as an important issue. And I would say that overall, one of the biggest issues in all four contexts that were looked at were the wider issues of gender discrimination, whether it was sexual violence or or early marriage or other problems. Somehow, girls' lives seemed to be less than, and they were commoditized in significant ways. And it was very clear the girls did not have the same rights being realized as boys. And so I think there's a big task there in terms of social change, and we have to work in a way that keeps these gender issues on the screen, and as Philip said, to attend to the issues affecting boys as well. And then on the question of family, I think family really surfaced as highly important. When you ask people, what were their supports, family was very much at the forefront of what children pointed to. And thinking back about mental disabilities in Cambodia, I interviewed a boy and his family, and who became clear as we talked that the boy suffered from mental disability and was really quite stigmatized. But his family did, I think the best they could under the circumstances, helping this boy. But I think that we also have to recognize the imperfection of the family systems and the fact that sometimes specialized supports and care really are needed, and maybe that's where some of those case management approaches would be very helpful. And then, Alistair, to your important question, I think we just have so much more to learn about how to reach and assist people, children who are highly vulnerable. The very first issue to deal with, as you know better than I mean, it's the profound stigma that makes some people so profoundly vulnerable. Not only will they be hidden away by families and communities, but they themselves will hide from view, either from their shame or their pursuit of their own approaches. And I think we're not very well positioned sometimes to support. We go in as helpers, and sometimes they're not interested in being helped. They're out there, plugging away in very difficult environments. So I think there the best thing to do is to adopt a strategy of deliberately looking out for the most vulnerable, but also of accompanying and not judging and not being in a position of helping, but learning from them what are the things that would actually perhaps enable them to solve life problems, the practical problems that they face day by day. Thank you. Over to Andy now.
Thank you very much, Mike. So again, trying to be brief here. On the first question on government, so just to highlight one particular area where we have achieved particular success is through working with traditional leaders where they have authority, they are linked in with the formal government systems, and they are able to instigate local bylaws to reinforce the CRC and national legislation and policy in order to, for instance, prevent child marriage or FGM at the local level. This is a particular approach that we have found to be particularly successful in countries like Tanzania, Zambia, Sierra Leone, quite wide-ranging number of countries across sub-Saharan Africa. Then on gender, I think Philip and Mike have covered this particularly well. I think the important thing to remember is that we're not just talking about girls here, girls and young women. We're obviously talking about boys as well, who, as Philip has pointed out, can end up being more exploited through child labour or different forms of child labour to girls. Then just on case management practices, we, as I think Philip was saying, our approach is to actually defer case management to the formal mandated structures and systems where they are present, and where they are not present, encourage and equip and enable locally formed child protection committees and groups to do that insofar as they can. And we have a very good example from Somaliland, for instance, where in the PPA, where such groups are managing cases at a local level as best they can. And then on the question of the role of families and family practices, World Vision works in our child protection advocacy program, works very closely with families of most vulnerable children. We use the adaptive assessment process to identify those particular families. And then we have a home visitor program to actually visit and monitor those families with volunteers, and we also have a sort of a positive parenting program called Celebrating Families as well. And in South Sudan, for instance, again, with EPA, we have got quite an extensive network of volunteers who are monitoring and supporting those most vulnerable families or children, families with most vulnerable children. And also just to point out that our work on addressing harmful traditional practices and social norms also spreads down to the family level. It's not just a community level, it's families who also perpetuate those harmful practices and are open also to changing their particular norms and approaches. And then finally on child-friendly spaces, thank you for your challenging question, Alistair. Firstly, I'd just say I don't think I've got a clear answer here, really. It is a tough question. Obviously, we're working in very different contexts. I know the research you've been leading has been in refugee or IDP camps. I'd also just say it's not a new problem. I recall with OVC programming in Africa, there were major challenges about ensuring that children identified and presented as OVCs really were the most vulnerable. Were they really OVCs or not? Particularly as more resources became available to those groups. And also there's a big issue of stigma around identification of vulnerable groups as well. But I would just say that we need to continue deliberately targeting and seeking to sensitively identify those who are most vulnerable and not give up, clearly. Thank you.
Thank you, all three, for those very thoughtful replies. This has been a very full hour and a half of learning, and a big thanks to all of you for really just such thoughtfulness in presenting, but then in also thinking through the implications of this in line with what the various participants brought to you as questions and comments. I think we're at the beginning of a steep learning curve here, and this definitely helps take us a few notches up the mountain. There were a few questions that we didn't get to, and again, I think all of you can currently see the website of IICRD, where you will be able to find Philip's contact information, and I would encourage you to reach out to him. We've been asked if the slides will be available, and they will be. This webinar was also recorded and will be available on YouTube in the very near future, so we will send an invitation to or just an announcement to everybody when that and the slides have been posted. With no further ado then, a big thank you once again to Dr. Philip Cook, the Executive Director of the International Institute for Child Rights and Development, Dr. Mike Wessels, who is not only the Principal Investigator of the Interagency Learning Initiative on Community-Based Child Protection Mechanisms and Child Protection Systems, but also a professor at Columbia University, and Andrew Ware, the manager of the Policy and Program Unit at World Vision UK. Thanks for this learning, and we will keep everyone posted about the next webinar in our series on child protection systems and reaching the most vulnerable children. Thanks, everyone.
Thank you, Mark.
Thank you, Mark.
Yeah. Thank you, everyone, for participating.